So we reinvigorated our EMS activities about 4 years ago when my colleague Kristi Edwards came on board. So we worked with our EMSC colleagues to help collaborate on understanding what they're working on, share with what we're working on so that we can work together in areas of mutual interest. So she helped them with a research project that they were doing, looking at survey results around pediatric readiness. And from that survey, we realized that 80% of critical access hospitals responded, indicating a real interest that they had in learning more about pediatric readiness. So more recently, we've been working with them around their critical Crossroads project, a toolkit on care pathways. So we've been able to tap into their experts around pediatric mental health crises and able to, once that toolkit comes out, share that far and wide with our stakeholders. So we really appreciate being able to tap into their pediatric expertise that doesn't exist with our rural stakeholders. So within the work that we do across rural, we're really focused more generally because there aren't a lot of specialists in rural areas. Most of our EMS funding is targeted to states and they work across the age population. We did fund a project that 37 states came in for, kind of a small supplemental project for them to work around a specific EMS project. So there was one out of the 37 states that did come in to support pediatric readiness, and that was our Missouri State Office that came in. And so the Missouri State Office of EMS is working with several rural EMS agencies around this pediatric readiness project. So that project is currently underway. So we have a new funding opportunity that we're really excited about. Again, focused more generally across rural health, and we're asking for our state partners to come in. There's a competitive opportunity for up to $250,000, focusing on one of two different areas. They can come in around sustainable models of care for EMS, looking at more of the business operations aspects of emergency medical service agencies, or kind of new for us is a focus on quality measures related specifically to EMS. So with those projects, it'll be a 3-year funding opportunity, and we're looking to really find out what's working in terms of this funding model through states to support EMS programs, and then how can we take what works at the end of these 3-year pilot projects to really inform more of what we're doing with our state flex funding. We also have a variety of grants that are targeted to communities where communities identify what need they have. And so we have upcoming projects that any EMSC agencies or other stakeholders that they work with are eligible to apply for if they're in a rural area. And these grants can be used to target EMS or emergency medical services goals as long as the applicant is in a rural area. So upcoming ones are the Rural Health Network Planning Grant, as well as the Rural Health Network Development Grant. Oftentimes when people are thinking about what works in rural, they kind of think about it after either a research project is underway or initiative is started. What we encourage people to think about from the beginning, whether it's through a project initiative or a research project, is thinking about rural from the beginning. So in one component, it's thinking about what are the challenges that someone in a rural community might face, children in rural communities, how do rural EMS agencies function, and understanding the challenges about lack of resources that are available, lack of staffing to take on new projects, or the distances that are traveled or the distances that these rural EMS agencies have to traverse to do the work that they do. The other thing is, from a research perspective, trying to get researchers to think, is it possible to do a rural-urban cut? So we can see if there are any disparities between rural and urban EMS agencies. So we encourage both people implementing projects and researchers to think about this from the beginning. The vision for the future of EMSC is pretty simple. It's just having a program that where data and projects are relevant for rural EMS agencies. We encourage all of the EMSC stakeholders to really think about who they can be linking with in terms of rural partners. The state offices of rural health, there's one in all 50 states, are a great partner. Some of them are more actively engaged in EMS projects and can be a great resource in really understanding the needs of rural EMS. Others are not as engaged working directly with EMS projects, but are a great resource in connecting folks with other rural stakeholders who can help achieve any project goals.